Hey, welcome everybody. We're so excited to have you join us today. Today's webinar is going to be 2022 Workers' Comp and Benefit Requirements, How to Keep Compliant. You're going to come away from today's session with a high-level understanding of employee benefits and how to make informed decisions for your business.
Before we get started, let's go over some quick housekeeping. All attendees are in listen-only mode and will remain muted throughout the webinar to minimize the risk of any background noise. However, we do want to get all your questions answered. So go to the question section of GoToWebinar and please ask your questions as we go along. We'll get to as many as possible at the end, and if we run out of time, we'll follow up with you via email. Speaking of emails, tomorrow you'll receive a copy of today's slide deck and more resources. For now, go ahead and check out that handout section. Now let's meet your presenters. Hi, my name is Jordan Perry. I'm a senior product specialist here at OnPay, and I have more than 10 years experience in benefits and payroll.
My name is Kelly Finn, and I'm one of OnPay's senior product consultants with many years of experience in payroll and customer service.
My name is Sandra Akins, and I'm also a senior product consultant here at OnPay and have extensive experience in payroll, account management, HR, and customer service.
Good morning, Paul Forey, Director of Insurance here at OnPay Insurance Agency. Happy to be with you.
All right, so we have a lot of great information to cover today. We're going to start with some must-haves like workers' comp, mandatory short-term disability, retirement mandates, and how to make sure you're staying compliant.
Then we'll talk about benefits most commonly offered, as well as which ones are most sought after by employees and additional perks and benefits you could be offering. We'll also talk about how you can go about offering these benefits to your employees if you're just getting started.
Before getting into the details, we'd like to get to know a little bit more about you guys. So here's a quick polling question. Let us know in the questions panel which benefits you currently offer your employees. You can list benefits such as health insurance, PTO or vacation, retirement plans, or other. And if you don't offer any benefits but would like to, you can tell us that as well. So go ahead and enter those benefits that you do offer your employees in the question section of the GoToWebinar question section. Let's see what we have here.
I'm seeing several people who don't offer anything yet but would like to. Some PTO that is being offered. Health insurance, PTO, a little bit of everything.
Yeah, mostly PTO, which is awesome.
All right, this is great. So when it comes to offering benefits, let's talk about what you're required to offer to your employees as an employer.
As an employer, you're required to provide certain benefits to all of your employees. That includes things like time off to do military service or go to jury duty. You also have to withhold FICA taxes to pay into their future retirement or disability benefits. And as your company grows, there are federal laws you'll need to comply with. You'll also need to comply with all workers' compensation and short-term disability insurance requirements for your state. Let's talk a little bit more about the last two on the list, workers' compensation and short-term disability. Hey, Jordan, can you tell us a little bit more about workers' compensation?
Absolutely. Workers' compensation protects both employees and employers when someone gets sick or injured on the job. Here are a few questions we get asked frequently whenever it comes to workers' compensation. First, who's required to have it? Right now, Texas is the only state where workers' compensation is voluntary, although it's still highly recommended. Requirements vary from state to state, so be sure to check out our article that outlines the workers' compensation requirements in every state. Secondly, what is a monopolistic workers' comp state? Although workers' comp insurance is usually purchased through an open market via private insurers, there are 4 states that are monopolistic states. This means that state has special legislation in place that requires workers' comp to be provided exclusively by that state's workers' compensation bureau. By law, no private insurance carrier can sell workers' comp in those states, so that state holds a monopoly over that type of insurance. These 4 states include North Dakota, Ohio, Washington, and Wyoming. Interestingly enough, the state of Washington collects their workers' comp premiums through Labor and Industries Payroll Tax, often called L&I. And lastly, what about employees who work in multiple states? It's important to know how the policy is written. This will determine how claims are paid. Employees can still have coverage when they travel to work in other states. There is usually a maximum amount of time an employee can spend outside of the state that the policy was written for and still file a claim in that state. The policy will typically cover injury and only pay out the maximum loss benefit from the state the policy was written for. Workers' comp law may also require that you have coverage in the state the employee is traveling to if the employee is in that state for 5 days, 10 days, 15, even 30. It all depends on the state. And this is something your insurance carrier will be able to advise you further on.
You mentioned it's important to know what or how the policy is written. It seems as though a lot of small businesses are leaning towards a pay-as-you-go policy. What's the difference between a pay-as-you-go policy and a traditional workers' comp policy?
Great question. Traditional workers' comp policies require a large upfront deposit each year, which can cause a big hit to cash flow for small businesses. The cost of a policy is based on an estimate of what the company's payroll will be and the nature of the job in which the employee is performing. So costs will be higher for an employee who are more likely to get injured. So think construction or manufacturing, while employees in safer roles in industries such as office workers have lower premium. At the end of a traditional workers' comp policy period, there will be an audit to determine how accurate that initial estimate was. If it missed the mark, you might have to come up with additional funds for your coverage, or you might get a refund. And those refunds can take some time to be paid out. With a pay-as-you-go policy, even if your business grows throughout the year, your premium is based on the actual payroll data as opposed to an estimate, so it's updated automatically. That is the biggest difference between a traditional workers' comp policy and a pay-as-you-go policy. And unless you're in a risky workers' comp class code or in a monopolistic state, your business will likely qualify for a pay-as-you-go policy.
So Jordan, what do employers need to know about short-term disability?
Well, state disability insurance or short-term disability coverage helps employees during off-the-job temporary disability, such as injury, illness, or pregnancy. These policies can offer leave benefits and income replacement for the employee. They're also mandatory in several states, including California, Hawaii, New York, New Jersey, and Rhode Island. Companies with employees performing work in those states must either provide or facilitate the procurement of short-term disability insurance for those employees. Rules for how they work vary from state to state. For example, in California, short-term disability coverage is actually managed through the state directly, whereas in New York, an employer must obtain private coverage or purchase coverage to the state fund to meet that obligation. If you're not in one of these states, employers can still offer short-term disability as a benefit, and you have the option for it to be employee or employer paid.
That's really good to know, especially as income or job loss due to a short-term or long-term disability can be absolutely devastating to an employee financially. Providing disability insurance to employees can be really valuable and relatively low cost to the employer.
With all the importance that's placed on workers' comp and short-term disability, I'm glad that we started there today. But now let's talk about state-mandated retirement programs. In the last few years, 14 states have established requirements around offering a retirement plan. Depending on the state, the requirements vary by employee count. For example, California and New York City's new requirement apply to companies with more than 5 employees. The Illinois mandate extends to companies with more than 25 employees, but smaller companies will fall under that mandate within the next year. We're going to include a link to our article on state-by-state retirement mandates at the end of the presentation so you can see how that affects your business. Just a quick note, because this deadline is quickly approaching, if you are a California business with 5 or more employees, you will be required to offer some sort of retirement plan by June 30th, 2022.
Now, when it comes to retirement plans, 401k is one of the most common plans out there. A 401k is a qualified retirement plan, and that means it's eligible for special tax benefits under IRS guidelines. Employees can invest a portion of their salary up to an annual limit. Employers can match employee contributions, but are not required to. So 90% of employers do match employee contributions, and these contributions are typically at 3 to 5% of the employee's salary. The contributions are most often invested in a variety of mutual funds. And since 401k contributions are made with pre-tax dollars, they reduce your employee's gross income, thus lowering the payroll taxes that you and your employees pay. Now let's talk about why employers should offer benefits and how it can help your employees, you, and your business. Many small business owners mistakenly believe they cannot afford to offer benefits, but offer the right benefits, and your business just may jumpstart its growth.
When you offer your employees benefits, there are a number of advantages that come with it. It can help you attract and retain talent while decreasing turnover, which can save you money in the long run. 75% of employees say that they're that they're more likely to stay with an employer because of their benefit programs, and turnover can cost employers as much as double the employee's annual salary. According to Glassdoor, benefits are the second most important factor when looking for a job, right behind salary. About 60% of people report that benefits and perks are a major factor in considering whether they get a job offer, and 80% of employees would choose additional benefits over a pay raise. Not to mention the tax credits that you can earn and how certain benefits can decrease payroll taxes for both you and your employees.
Offering benefits also helps increase employee job satisfaction, which leads to higher productivity and an increase in sales and revenue. There are several studies showing that job satisfaction increases productivity. One such study from the Harvard Business Review showed that an average of 31% more productivity and 37% higher sales when employees are happy or satisfied. Jordan, what are the most common benefits offered by employers?
Well, according to our 2020 State of Small Business Survey, the top two most commonly offered benefits, like we saw in our poll earlier, are PTO or vacation time and health insurance. These are followed by retirement plans, paid parental leave, dental, vision, and life insurance.
And the benefits we don't see offered as much is the HSA and FSA plans, commuter benefits, and telecommuting or remote work options, although this has definitely changed during COVID.
And this doesn't look too different from the benefits that employees want most. With health insurance topping the list, it's closely followed by PTO or vacation time and retirement plans. Following these top three, employees are also looking for vision, dental, life insurance, paid parental leave, and lastly, HSA and FSA plans.
Let's talk about the benefits employees want most in just a little more detail. We know that health insurance topped both the list of benefits sought after the most and benefits offered most often. Generally, employers with 50 or employees are required to offer health insurance. But even if you're not required, keep in mind that 56% of employees consider health insurance to be a key factor in determining whether they will stay at their job. This is according to the Society of Human Resource Management. So it's definitely worth considering if you'd like to keep your turnover at a minimum. But you're probably thinking, what is this going to cost me? So Jordan, what is the average annual premium for health insurance?
Well, in 2016, the average annual premiums for employer-sponsored health insurance were a little over $6,400 for single coverage and just over $18,000 for family coverage. And that's according to the Kaiser Survey of Employer-Sponsored Health Benefits. Please keep in mind the cost of coverage for your company will be determined by the plans you select to offer, where you're located, and the demographics of your employees. Also, you may be able to deduct health insurance premiums that you pay as the business owner. Talk to your tax attorney or financial advisor to see if you're eligible for any tax savings. And remember, any plan you offer to your employees, you can add yourself to as well.
So paid time off is also a benefit employees often want. Paid time off can include vacation, sick days, and holidays. So when you're creating your PTO or vacation policy, you may want to ask yourself, how long will employees be required to work before they begin to earn time off? Is vacation just for full-time employees, or will you offer vacation time for part-timers too? Will employees accrue time or be given a lump sum at the beginning of the year? And will you reward employees that stay with you for a few years with additional time off?
You will also need to consider whether a use it or lose it policy or carryover policy will be best for your business and employees. Use it or lose it vacation encourages employees to take all of their vacation each year, while carryover policy allows a little bit more flexibility for employees that need to take a little bit longer time away from work.
Some state laws may require you to pay employees for unused accrued vacation time in the event that they quit or are terminated. So it's a good idea to do your research about the requirements in your state so you're ready when it happens.
FMLA already requires that employers with 50 or more employees provide at least 12 weeks of unpaid leave and job protection to employees who need to take time away from work to care for themselves or a family member during a serious illness, injury, or after the birth of a child. However, there are some states that require paid leave options as well. In the resources we'll share with you at the end of the presentation, we've included state-by-state paid family leave requirements, how to create PTO policies, and so much more.
Thanks, Jordan. Now, there are other benefits you can offer your employees outside of what we've just mentioned that you may not have thought of before. You can offer paid time off for volunteering, which is a way to strengthen team bonds and boost an employee's image of their employer. OnPay, for example, offers our employees one-time paid day off each year for this purpose, in addition to employer-sponsored team volunteering to give back to the community. Now, it's no surprise that with COVID-19, we're seeing an increase in work from home benefits, and a whopping 60% of employers offer this to employees. It's a way to prevent employee burnout, and this flexibility comes with a higher employee job satisfaction. Or if possible, offer tuition reimbursement to your employees. Doing so reduces employee turnover, brings in knowledgeable workers to your business, and best of all, is tax-free under a certain amount.
All right, let's go have another polling question. After reviewing benefits, all the options we've presented to you and how you can offer them, we'd like to know if there's anything else that might be causing some hesitation. What are some obstacles you might be facing when offering these benefits? Could it be the cost? Just let us know in that question section of GoToWebinar. Is it the cost? Are you worried about the employee participation, not getting enough participation there? Could it be a lack of general knowledge about certain benefits? Is it the pain of plan administration, having to add employees to the plans and removing them whenever they leave your place of work? Or could it be something else? Just let us know in that questions panel. I'm seeing a lot of, some cost questions, just general lack of knowledge, employees in multiple states. So for employees in multiple states, we can absolutely help you out with that. We can definitely help you get a plan that kind of covers everybody in all of those states. General lack of knowledge. So yeah, I'm seeing a lot of that lack of knowledge, plan administration, which we can help you with here at OnPay. We can definitely get you pointed in the right direction with that.
Now, if you're ready to find out more about adding benefits for your business, OnPay can certainly help. We offer everything from health insurance to 401ks to workers' compensation plans for our clients. And our in-house team of licensed agents can take the guesswork out of selecting a good plan. They'll help you narrow down the best choices for your business and even handle all of the paperwork. Just go to onpay.com/benefits to get started.
Also, be sure to check out this whole list of helpful resources on our website where you can learn more about any of the benefits that we've talked about today. But without further ado, we're going to hand it over to Paul, our Director of Insurance here at OnPay, to answer any kind of questions that you have. Same place as you guys have been doing the polling. Ask those questions there in the GoToWebinar panel. No question is off limits. We might not be able to answer it today on the webinar, but we're absolutely going to follow up with anybody who we need to afterwards. So please ask us any kind of questions that you have, and then we can get Paul involved. So I am seeing a couple questions come in. Paul, how much I'm sorry, how many employees do you need to establish a health plan?
Good question. I hope you can hear me. I've just been sitting
Yes, we
back
can.
listening. So the answer to the question really is two. So if we have two employees at a company that are full-time and eligible for benefits, usually, again, full-time is defined 30 hours or more, we could get a quote from various insurance carriers for medical, dental, vision, whatever benefits the client is looking for. So that would be kind of the minimum number. And of course, we couldn't write a group of just two people if the two are owners of the company. One of the two must be a non-owner employee. And of course, we couldn't write a group of two if there were, say, for example, 10 full-time eligibles at the company, because that wouldn't meet the carrier's participation requirements. And rule of thumb, the carriers want at least 50% of the full-time eligible employees to participate in the group benefit. And the other caveat they have to establishing a small group is the expectation is that the company will at least pay 50% of the single only premium. I hope that was helpful.
Yeah. So to continue that, when offer employees health insurance, do clients have to offer the coverage to the immediate family members too? Is it state specific?
Right. So no, they don't. They can simply offer. So what most companies do is they will offer and pay a portion that we just talked about to the full-time employees, but there is no requirement that they would pay any of the premium for spouses and dependents. So it's very common for a business to pay the minimum 50% or more of the single premium for the employee. And if the employee elects to add spouse and dependents, the employee would pay 100% of that premium.
Okay. So somebody had mentioned that they were finding it difficult to find vendors to work with their small business. So can you speak to the vendors that we work with and how OnPay can help establish benefits for small
Sure.
businesses?
If we're talking benefits, which I think we are, it's pretty universal in all states that small group starts at two. And so again, if we had two full-time people, again, can't just be owners. We already talked about that. We have plenty of vendors in each state. In most cases, we offer 2 or 3 vendors. I think we offer Blue Cross, Blue Shield in almost all states, United Healthcare, Cigna. There's some other carriers, obviously, that too numerous really to mention, Aetna, et cetera. So we don't see that as a problem in establishing group coverage.
Okay. So other than medical, what other benefits can we help establish for clients?
Sure. Many of our clients will start out with a package of medical, dental, and vision. The medical, again, as we talked about, the company has to pay a portion, 50% minimum, of that single only premium. And most businesses will offer dental vision to the employees, but again, it'll be on a voluntary basis where the employee, if they want dental and vision, has to pay 100% of that premium. So, really can be a package based on what the business wants to offer and what the employees want to pay for. So beyond that, though, we have another group of clients, usually when the business gets a little bit bigger, looks to add to that benefits package by a small package of term life insurance. and that's usually company paid. It's very inexpensive. And again, the business likes to know that all the full-time employees are covered for, say 25,000 of death benefit. There's other increments, but 25K or 50K or one-time salary to 50, something like that. But they would also then consider a company paid portion of short-term disability and long-term disability. And again, that's why we get a census of the employees, we get dates of birth, and we can look at all the different benefits that are available, and we can move based on what the client and the employees are looking for. It's very common to start out medical, dental, vision, and add after things get started, maybe the next year. So that's a very common benefits package. Clearly, as a business grows, there's other benefits that are also available. Some people like to add an EAP benefit for employees assistance program. Again, very inexpensive, but very useful for employees, especially in today's world where employees need assistance for all types of items that can come up in their daily lives. So that's kind of the common benefits. And I'm not addressing the 401k, which obviously is also a benefit. So there's really numerous benefits that can be offered depending on the business and as it grows.
Perfect. So what about, I know you said it starts at 2 employees. So do you have any recommendations for insurance or a comp or anything for just a small business that hired their first employee?
Well, again, depending on the state. So in most states, as Jordan talked about on the work comp, Texas is the only voluntary one, but in most states, and there are a few exceptions, as soon as you have 1 employee, you have to provide them workers' comp coverage. And so as long as the business is not in an extremely hazardous type of business, the carriers that we represent, which are multiple for workers' comp, we can offer them a proposal, a quote. The only ones that we cannot quote, again, like I said, somebody's very hazardous, a roofer and things like that, where they have to get their coverage, their workers' comp through the state fund, because again, very hazardous. And the commercial carriers, Hartford, Travelers, Berkshire Hathaway, none of them are going to offer a contract, if you will, to somebody that's in a very hazardous industry. When it comes to the benefits, again, there are some states that as long as we've got 2 employees, but let's say only 1 wants coverage, say an attorney firm, and the attorney is employee 1 because they're the owner, they're full-time, and they hire a paralegal or an assistant. And the attorney has coverage through maybe the bar association, and they want coverage for the 1 employee. Well, if it's a state that requires 2, but will allow us to just write coverage for 1, 50% of the participation that I had mentioned, we can write coverage for that 1 person. So I really need to know more about what state the person's in, et cetera, because some of them will allow a group of 1, again, as long as it's sponsored by a business, the business pays 50% of the single at a minimum, and we hit that 50% participation requirement. In this case, 1 out of 2 is 50%. So Sister Mary would be very proud of me that I was able to make that calculation.
So you mentioned full-time employees. What about part-time employees that typically work under 30 hours, but from time to time they go over that 30-hour threshold? Are they required to be insured?
They're not required. And that's kind of a gray area, to be honest with you. I mean, if someone says, I've got someone that normally works 32 hours, but occasionally when business is slow, they may only work 24. As long as they're consistent and they're offering, in that case, they'd want to offer benefits, that's something that can easily be done. In the other situation, somebody normally works 24 and occasionally might work 32. Again, I would say we would probably not want to offer benefits in that situation. It really becomes a question of affordability. How does someone with only 24 hours of work afford employee benefits. But again, it all depends on who's paying the premium. So it really is, again, a situation I need to know more, but rule of thumb, 30 hours or more, we need to offer the benefits. And as long as we're hitting the participation, again, most states, 50%, we're good. So I hope that helps. More of a kind of a case-by-case answer required on that one.
Sure. Yeah, and that's why you and your team are really good to work with clients. So whatever the specific need is or whatever the specific ask is, you guys can help.
We do have, just FYI, we have a couple of clients that really have just part-time employees, and they wanted to do something for the employees. So for example, you can purchase a policy for a teledoc service. So 24/365 coverage for teledoc. So an employee, quite frankly, who has no benefits, and I'm working part-time, 12, 15, 18 hours, the employer could pay for a teledoc service. It runs about $20, $22, $25 per employee per month, but it gives the employee 24-hour 365 coverage to call a doc or get on a computer and have a webinar, face-to-face with a doc, and see what the issue is, and then the doc can make a referral, can issue a script, and so it's not a full-fledged benefit, but if that's what the employer is trying to accomplish, offer something of value in the area of benefits to have the employees come and stay with me working as opposed to someone across the street, we have seen that work. So it's just a teledoc benefit, but in the right scenario can have a lot of value.
Oh yeah, and we know definitely with the environment that we're in now, having telecommunications, especially telecommunications with a doctor, is very, very beneficial. So that's
Absolutely.
great. That's great. We were able to help clients out like that. Somebody's asking, how do we get in contact with you? How do we get in contact with your team? What are the next steps to get started?
Do you guys, I apologize, do you have a set way to ask get in touch with us? Or, I mean, personally, I don't care. Giving my email address out is fine. If somebody wants to talk, that's what we're here for.
OnPay.com/benefits. There's a way that you guys can schedule meetings with our team. You pick a time that works best for you guys, whatever 30-minute meeting works. You can check out resources on the websites, but basically it's going to the website, and then also after the webinar, we're going to send out a copy of everything that's got the links and everything there. So whoever's on the line, whoever wasn't able to join today is still going to get a copy of it too. So definitely ways to get in touch with us afterwards.
Perfect, thank you.
Yeah, we do have one more question. It's about workers' comp that somebody's asking in kind of your experience. Have you ever known of or seen issues when people have changed worker status, going from employee to contractor or contractor to employee?
Okay, so the way workers' comp works is the carrier is only going to quote for employees. And obviously, if someone is a contractor, they don't fall under the coverage of a workers' comp policy. It's there for the employees. And so what happens many times is, let's say I have, 2 employees and I cover them for workers' comp. And I also have 1099s that I utilize to get things done. The point is, the business, when you utilize the services of a 1099 contractor, the expectation by the carrier for the workers' comp is that you, as the owner of the business, are verifying that that contractor has their own workers' comp coverage to protect them. Because we all know that if someone gets hurt on the job, they don't really stop to think, oh, am I an employee that got hurt or am I a contractor that got hurt? They're going to try to submit a claim. And the carriers know that for the most part, if this goes to, a legal proceeding, hey, you're not an employee, you weren't privy to coverage, you had a claim, you're now seeking legal remedy, the carriers know that in most cases, they're going to end up paying that claim for that contractor in which they receive no premium. And so the process is when the carrier does an audit at the end of the year, they ask for not only your payroll records, but your checking account records. And they're going to look through everything and go, okay, we see the two employees. They are, retail store employees. They were covered under the retail store employees in the policy. Not a problem. Wait a minute. On your checking account, who are these 6 people that you were paying pretty regularly during the year? Oh, well, those are our contractors. Okay, well, where are their certificates of insurance? And if you cannot produce those certificates of insurance from those contractors, that carrier is now going to bill you a workers' comp premium for those contractors. And that can be a real problem for folks. So to be honest, I don't know if I'm really answering your question. It's pretty much you have to decide, and there's many resources out there. Are these W-2 employees or are they contractors? And if they're W-2, they should be accounted for based on their work activity in your policy for workers' comp. And if they're not, they're 1099s and you should be getting certs. And the problem comes is when that is not clear. And again, I hope that helps.
It does, yeah. It just kind of leads me to think it's another reason why people should contact us for help, honestly, because it really is a case by case basis.
It really is, and it's also, can be a gray area. I'm sure we've all seen those, IRS checklists of employee versus 1099, and you start working down the list. Do you tell them what time to be at work and what time to leave? Do you provide the tools necessary to do their job, etc.? And like I said, if they're an employee, they're an employee. They're a W-2, and they should be on the work comp policy. And quite frankly, that's why you have, CPAs that can help you go through that and determine, is it an employee or is it a contractor?
So well, that's great. That's really great information. You're definitely very, very knowledgeable in all of these topics. So I appreciate you joining us today.
I wish I had all this knowledge and didn't have to be in the business for 30 years.
What about companies that are registered in one state but have facilities in another for workers' comp coverage? Is that something we can totally help with? Is it hard to establish coverage?
No. So when they get their quote for workers' comp, let's say they're in California for just a starting state. So they get a quote because their employees are in California and they decide to go across the border to Arizona and open up a store there or a facility. All they do is contact the carrier and let them know, hey, Hartford, I now have a second facility. Here's the address in Arizona, and here are my 1, 2, 3, 4, 5 employees and what they do in Arizona or Nevada or Colorado. And all the carrier does is endorse the policy to include now those additional states. And the reason it's done state by state is the pricing and the benefits are different state by state.
Okay. Well,
okay? So it's really not a problem. You just need to communicate with the carrier, and then on the payroll, you have to make sure that you're putting the employee in the correct workers' comp state on the payroll platform, and that's about as far as I go with payroll help.
Oh yeah. So our staff members we can help establish or set up everything in the system as you need to in your OnPay account for sure. But that pretty much has gotten to the end of our questions. Any Anything else we didn't answer today, please feel free to reach out to us. Again, we're going to be sending everybody all the package information, the handouts, all that kind of stuff too after we conclude. But thank you so much to Sandra, Jordan, and Paul for joining today with all of your expertise, information, and everything. And again, thank you to everybody on the line for joining today. It was great. So from all of us at OnPay, enjoy the rest of your week.
Have a good one.
Thank you.
Thanks, guys.